Hello, everyone. My name's Will. We just found out from President Trump that within 2 weeks there will be a peak in death rate. And because of this, I feel that we should have a conversation about making our own homemade face masks. Just a few months ago, when there were only a few confirmed cases of COVID-19, the U.S. Surgeon General, CDC, and the U.S. Department of Health and Human Services all pled with the American public to not wear face masks unless they were sick or caring for a sick person. Seriously, people, stop buying masks. They're not effective in preventing general public from catching coronavirus, but if healthcare providers can get them to care for sick patients, it puts them and our communities at risk. Fast forward to now, we now have thousands of cases of COVID-19 across America. President Trump recently mentioned this past Sunday that the final U.S. coronavirus death toll will range somewhere in between 100,000 to 200,000 Americans. The worst case scenario and high end of how many Americans could die is 2.2 million deaths if no measures were taken to slow the spread of coronavirus, such as staying at home, social distancing, maintaining consistently good hygiene, and cleaning, disinfecting high-touch surfaces such as our phones, doorknobs, faucet handles, etc. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, has recently made this possible scenario, which also includes millions of coronavirus cases.
Well, Dr. Burke said yesterday, as you know, that she doesn't think any city will be spared from this virus. How many cases do you think the U.S. will reach? 1 million cases? 10 million cases? Or do we not even have any idea?
You know, Jake, to be honest with you, we don't really have any firm idea. There are things called models. And when someone creates a model, they put in various assumptions. And the model is only as good and as accurate as your assumptions. And whenever the modelers come in, they give a worst case scenario and a best case scenario. Generally, the reality is somewhere in the middle. I've never seen a model of the diseases that I've dealt with, which the worst case scenario actually came out. They always overshoot. So when you use numbers like 1 million, 1.5 million, 2 million, that almost certainly is off the chart. Now, it's not impossible, but very, very unlikely. So it's difficult to present. I mean, looking at what we're seeing now, you know, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target that you can so easily be wrong and mislead people. What we do know, Jake, is that we got a serious problem in New York. We have a serious problem in New Orleans, and we're going to be developing serious problems in other areas. So although people like to model it, let's just look at the data of what we have and not worry about these worst case and best case scenarios.
Now that we are in this current critical phase of the coronavirus pandemic, President Trump referred to his coronavirus task force's modeling estimates and that the peak in death rate is likely to hit in 2 weeks. Here's President Trump.
The modeling estimates that the peak in death rate is likely to hit in 2 weeks. So I'll say it again. The peak, the highest point of death rate, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines that our great Vice President holds up a lot. He's holding that up a lot. He believes in it so strongly. The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread.
So, for the past few weeks, we have been isolating and quarantining ourselves, practicing social distancing, practicing good hygiene, such as hand washing and cleaning, disinfecting high-touch areas. Now, according to our president, the peak is likely to hit in 2 weeks. So please, more than ever, let us practice what we have been taught to do by our health officials and our government and President Trump's coronavirus guidelines for America. With that said, my first video was about making homemade hand sanitizers. In this video, we will talk about making our own homemade face masks. And before I continue, in Dr. Oz's recent interview with U.S. Surgeon General Jerome Adams, he mentioned that health experts have started to question the official guidelines about whether healthy people should be protecting themselves with a regular surgical mask, like wearing even a bandana. Dr. Oz asked, what should we tell people now? Because we've been saying all along, don't bother. It doesn't make a difference.
Well, that's a great question. And again, it's one that you and I talk about often. The evidence, the recommendations from the WHO, the World Health Organization, the CDC, and from my own office, all right now recommend that the general public should not wear a mask because it does not protect the individual wearer from getting the virus. And there is conflicting evidence out there, but there's actually some people out there, many people who believe that if you wear a mask and you don't wear it properly or you're not used to wearing it, you may actually touch your face more frequently and introduce virus to yourself. What a mask does, and what it's done in places like South Korea and China, is it protects other people from you. And if enough people wear the mask in a certain environment, it may protect asymptomatic carriers from spreading it to other people. And it's why we recommend masks for family members of people who are taking care of someone who's had COVID or someone who is at risk for COVID while they're in their self-quarantining if they decide to go out anywhere. We want to prevent them from spreading to other people. So again, in summary, a mask does not protect you from COVID. It protects other people in the event that you have COVID. And if everyone goes out there and makes a run on masks, and then we just had a whole conversation about supply chain, that means less masks that are available for healthcare workers and first responders. So right now, and we're reviewing the evidence every day, we will let you know if it changes, but right now we do not recommend that the general public wears masks.
Surgeon General, I really want to thank you really much, tremendously for appearing here. You're speaking directly to the American people makes a huge difference.
Well, and again, I want the American people to know that we promise you to give you the best information we have. That information may change. That doesn't mean that we weren't telling you the truth 2 or 3 or 4 weeks ago. That means that this is a rapidly evolving situation, and the CDC, the WHO, my office, the Office of the Surgeon General, will continue to give you the best and most accurate information that we have and to course correct as we learn more information. The conversation we had about learning from New York City. And I want people to remember that we will get through this. The timeline actually from China, from South Korea tells us we can get through this in 6 to 8 weeks as long as we all come together at a state, a federal, and a local level, and as long as citizens do their part to mitigate, stay at home.
We will go through each of the Surgeon General's responses. Here are photos of regular citizens during the 1918 Spanish flu pandemic. 500 million were infected with this virus, killing an estimated 50 to 100 million people worldwide. Health officials at the time pleaded for everyone to make any kind of mask and use it immediately and at all times. Even a handkerchief held in place over the face is better than nothing. According to the Surgeon General, we won't be able to wear masks properly and may accidentally infect ourselves in the process by touching the contaminated front piece instead of their strings or ear loops. The WHO and CDC have spent considerable time and resources to teach us proper and effective hand washing techniques with soap and water. If they are able to educate us, the public, about hand sanitation and hygiene, then please teach us how to wear masks as well. I am not downplaying the Surgeon General's concern, but I personally believe that they are not helping us being fully efficient and protected while we flatten the curve. Your clean and sanitized hands won't matter if your exposed face comes into contact with COVID-19. Notice that the Surgeon General said conflicting evidence about the effectiveness of face masks. That alone should tell you that this does not negate the physical evidence that masks block respiratory droplets and microbes. Our health officials are so focused on the public's inability to properly use a mask, which underscores the bigger picture that face masks reduced people's daily risk of respiratory infection by an estimated 60 to 80%. This came from a test conducted in Sydney, Australia, during the two winter seasons of 2006 and 2007. Exactly. For all you know, you are an asymptomatic carrier, meaning you may be infected with the virus for 1 to 14 days before developing symptoms. Coronavirus is transmitted by droplets and close contact. When we speak, droplets come out of our mouths. Hence, by wearing a face mask, you are definitely helping flatten the curve, as you will not be infecting others around you, especially when you need to go get groceries or to the doctor. Wearing a mask is infinitely beneficial not just to yourself, but also for others if you happen to have COVID-19 but not showing any symptoms. And it all boils down to common sense. Face masks are used by health professionals as part of droplet precautions when caring for patients with respiratory infections. Logically speaking, it is more than reasonable to suggest the following. A. Avoid crowded areas. And B. Use surgical face masks when exposed to high-risk areas. Again, the importance of face masks is being downplayed. Even if it is not protecting you, you are protecting others if you happen to have COVID-19 but not showing any symptoms. And yes, I agree, our health officials and first responders should always be first to acquire such face masks. And as the WHO has helped us make homemade hand sanitizers, please help us make our own homemade face masks. I believe that this will soon change. President Trump mentioned the peak in death rate will occur within the coming 2 weeks. Even more important to be wearing a type of face mask if you are not at home. Granted, wearing a face mask should not be a reason to stop practicing social distancing. And I feel that this is probably the main reason why our health officials are focused on us staying at home instead. Just like safe sex is no sex, to be safe from virus is no social interactions. And we appreciate all our health officials are doing and what President Trump is doing with his coronavirus task force. Again, please help us make our own homemade face masks, as well as how to properly utilize them. In fact, the CDC has this on their website for healthcare providers, which is titled Face Masks. HCP use of homemade masks. In settings where face masks are not available, healthcare providers might use homemade masks, for example, bandana or scarf, for care of patients with COVID-19 as a last resort. However, homemade masks are not considered personal protective equipment since their capability to protect HCP is unknown. Caution should be exercised when considering this option. Homemade masks should ideally be used in combination with a face shield that covers the entire front that extends to the chin or below and sides of the face. Great advice, and we will all follow your guidance in mitigating this coronavirus pandemic. However, with the peak soon to happen in 2 weeks, you need to educate the public about being safe when not in their homes. Please don't be too focused on hand hygiene. Please discuss face masks, eye protection, and even head protection. I am sharing this information because the next 2 weeks will be critical. Please stay at home and only go out for emergencies. And if you do, please wear a face mask and bring a hand sanitizer. It will be a difficult time, but it is a sacrifice we need to make sure that we are all safe from COVID-19. Take care, everyone.